know that as the population of India is increasing and so are increasing the cancer patients. Most of our cancer patients are diagnosed very late. They come in third or fourth stage. So what does that mean? That means that we talk of controlling the disease rather than curing. Most of the patients do not have access to the quality treatment. What does quality treatment mean? It means that you plan the treatment, you properly stage the disease, and you execute your plans so that patient have benefit in terms of improved survival. About 60% patients in India are devoid of quality treatment. We have disproportionate infrastructure, facilities. Some hospitals, they are well equipped, some are not. Some have skilled people, some have not. Another important issue is that treatment cost is out of reach. Not all of our patients are insured. So, delivery of equitable, quality, and affordable treatment is still very difficult to execute in a country like India. This is the dismal picture of cancer. But is this the only picture? I don't think so. Because since last 10-15 years, a lot of advances have been made. We have understood the biological behavior of cancer. We have improved our treatment modalities and facilities. We know that there are various preventive measures with which we can halt the cancer progression within our body. We have good infrastructure, good hospitals, good skillful people available which can do a quality job and benefit patient, and patient can have improved survival. So yes, cancer is preventable, cancer is treatable, cancer is defeatable. It's just that we have to understand it. Now, there are a lot of queries among patients, their attendants, their relatives about the cancer. We learn so many things from internet. There are so many things available, but still, the basic, I think, somewhere we lack in understanding this cancer phenomena. There's an old saying that if you want to defeat your enemy, you need to understand your enemy very well. Same is the case with cancer. Now I'll be answering certain important or common queries which occur in everybody's mind that will help us in turn understanding that cancer is preventable, treatable, and defeatable, which is our topic today. What is cancer? What is cancer? So our human body is just like a house. You see, a house has different rooms for performing different functions: bedroom, dining room, restroom, etc. Same way, our human body has different systems for performing different functions. We have respiratory system, we have digestive system, we have excretory system, etc. So, but all these rooms in a house, they are made of bricks. One brick, two brick, thousands of bricks, they make a house. So we can say that the functional unit of a house is actually a brick. Single brick. That is the functional unit of a house. Same way, inside our body, there is a cell. So cell is the functional unit of our body. Millions and trillions of cells, they form a particular organ. Now take an example of a brain. So millions of trillions of cells, they form the brain. We know how to read, we know how to write, we have intelligence, we have thinking. This all is because of the brains. And why? Because all these cells within the brain, they work in coordination. They have a particular work to perform. They perform that work. That's why that helps in performing the normal functions of the brain. So this means that something inside cell is there that programs it very well. Every cell has a definite life cycle. There's a birth of a cell, then there's a death of a cell. There is a definitive life cycle. Within that life cycle, the cell performs a particular function which it has been told to perform. Another important thing is that there are If at all there is any damage to the cell during its life period, it gets repaired so that it performs well, it does not perform abnormally. So this means that something within the cell is there which controls it. Yes, there is something inside. So in the cell, within the cell, there is a nucleus, and in that nucleus there is a protein thread-like material on which are present our DNA, which are known as chromosomes. Now on the chromosomes are present DNA. Now on DNA are present genes that control all these things inside our body. There are thousands of genes present inside in a particular cell. Now, if we categorize these genes, just remember the example of a car. A car has an accelerator, a car has a brake, and a car has a clutch. Now, with accelerator, you accelerate the speed of a car. With brake, you decrease the speed or keep it within the normal limit. And with the clutch, you modify its travel. Same way, you modify the gear change by using a clutch. Now, same way in our body, in that the genes are of three types. One gene is an oncogene, which helps in the growth of a cell, which increases the production of growth of a cell. Then there is another set of gene which is known as tumor suppressor gene, which maintain this growth. Beyond a certain limit, the growth will halt. And then there is an accelerator kind of thing. These are repair genes. Whatever the damage that occurs in a particular cell during its lifetime, it repairs those so that cell performs normally. So what happens when the accelerator fails? There is excessive growth of cells within a particular organ. Now the brake is not there because the tumor suppressor genes are not working properly, and at the same time the repair work is not there, so the cell becomes abnormal. So any abnormal cell with increased production, it results in the form of a tumor. It results in the form of abnormal growth of a cell within an organ and causing the organ dysfunction. Another important thing is that when these cells get dysfunctional and the production increases, they may go into your blood, through the blood circulation. They may go to another organ, get lodged there, and then again grow there. So this is what cancer is. Any cell which is produced in excess, there is uncontrolled growth, and it does not function. It's an abnormal cell which is functioning abnormally. So abnormal, uncontrolled production of cells within an organ with a capacity to spread to another organ or metastasis to another organ is what cancer is all about. So if a cancer occurs in a body, it causes a particular dysfunction, it causes crippling, and also it can spread to other parts of the body and cause damage to it. So does this cancer occur overnight? No. The answer is no. It's not an overnight phenomenon. Whatever changes that occur in gene because of our so many things, so many causes, these changes take years to actually allow a cell from normal cell to get converted into a cancer cell. So there are a lot of intermediary stages for a cancer cell to actually occur. So what does that mean? This means that if we take certain preventive measures, we may be able to halt the progression of a cancer within our body. Now, what are the causes of cancer? Most of the childhood cancers, they are genetic in cause. They have a genetic, there is abnormal gene dysfunction by birth only, and that ultimately manifests as cancer and in some part of their life. But in the adults, you will be surprised to know only 5 to 10% cases have a genetic predisposition. This means that you are born with some abnormal gene, and when you are adult, that gene manifests itself and causes cancer. So there are certain factors which are not in your control. Age, sex, then genetic component which you have. These are non-modifiable factors. But 80 to 90% of the cancers are because of certain causes which are in your control, which you can change yourself and prevent the progression of a cancer within your body. So these are known as modifiable factors. In India, remember the word idiots. IDIOTS. ID means improper diet, I means infection, O means obesity, T means tobacco and alcohol, S means stress, sedentary life habits. 60 to 70% of the cancers have one or the other reason or combination of all these three as cause of cancer. So if you we have seen that tobacco, it does not only cause an oral cavity cancer or a cancer of the lungs. Cigarette smoking, tobacco also causes cancers of food pipe, stomach, urinary bladder, kidney cancers. We have seen that obesity is one of the major causes of cancer of breast and ovary in females, or colorectal cancers in both males and females. Infectious diseases like hepatitis B, hepatitis C, it can cause hepatocellular carcinoma in a patient. Human papillomavirus infection can cause cervical cancers in females or oral cavity cancers in both males and females. Similarly, lot of chronic inflammations or chronic illnesses, they may be forerunner for cancers. Improper diet is also an important cause. High glycemic diet, low protein diet, and abnormal fat intake, more of the fatty food intake, is also a precursor of cancer. Obesity is the major cause of cancer, because what happens in the obesity is that there is increased production of estrogen, there is increased production of growth factors or insulin like growth factors, which help in the growth of cancer cells. So if you don't want to have cancer, you need not be an idiot. So if we take control of all these things which I have mentioned, cancer can be prevented. So remember LMNOP formula. L is low fats, high carbohydrate diet and high protein diet. Then M means more of fruits, vegetables, minerals, antioxidants. N means no to smoking, no to tobacco, no to alcohol. And O means organize yourself. P means lot of physical activity. So you need to have a increased physical activity. You need to organize yourself. You need to have a proper diet, proper sleep. You need to avoid stress inside your body, because what stress creates, it creates abnormality in you won't be able to realize what you have taken, what you have not taken, how much rest you need, how much rest you don't need, what are your habits, because stress takes a lot from your thinking. So avoid stress, avoid sedentary life habits, and increase lot of your physical activities that will help in prevention of a cancer inside your body. Another important thing is that we have to say no to processed meat also. We must understand that fresh meat is not carcinogenic. It is the processed meat which is carcinogenic, or stored meat. So we should avoid stored meat, because it contains a lot of intermediary chemicals inside, and that might be carcinogenic. So by attaining certain preventive measures or certain lifestyle changes, you will be able to prevent a cancer inside your body. Remember that you should, and a adult female should have BMI or body mass index of not more than 25, but in males it should not be more than 27. From 27 to 30 you are categorized as overweight, and above 30 you are categorized as morbid obese. So dietary and lifestyle changes are very important. Now another important thing is that how to identify cancer in a family. See, we must understand that any change which occurs in our body, which is unusual, which is persistent and which does not go in spite of some conservative treatment you are taking for more than, which persists for more than 3 weeks, that needs to be shown to a doctor or a cancer physician for checkup. You should always go for cancer physician for checkup if these symptoms persist for more than 3 weeks, which are unusual. One is persistent headache. Now, persistent headache can be a sign of brain tumor or it can be a sign of metastasis from anywhere. It can be from any other cause also, but the thing is that you should get yourself checked. Second, any ulcer within the oral cavity or on skin or anywhere which is a non-healing kind of ulcer. It's not healing in spite of so many of medications or ointments you are applying. Any painless lump in the body, in the neck, in both the armpits, in the breast in females or in the groin region, any lump which is painless, which is non-tender, these are the lumps that need to be examined by the clinician and subjected to biopsies if there is a high chance of suspicion. Any hoarseness in the voice can be a sign of vocal cord or voice box cancer, or it can be from the lung, or it can be from any other body and spreading to the vocal cords or involving the vocal cords. So hoarseness of voice. Now, any blood in your oral cavity, it can be hemoptysis from the GIT tract or blood in your sputum. It can be a sign of upper aerodigestive tract cancers. Blood in urine can be a sign of bladder cancer or even urethral tumors. Blood per rectum can be a sign of colorectal cancers or cancers of large intestines. Now, any lump which you are feeling on the abdomen which is painless, again, there may be some intra-abdominal malignancy. So we must go and get ourselves checked. It can be in females an ovarian mass, or in males it can be a large intestine or small intestinal mass. It can be anything. So constitutional symptoms like loss of weight, loss of appetite. Now, a person is eating normally, but still the weight gain is not there. He's considerably reducing weight, say 5 to 10 kgs in a month or two. It's a sign of worry. We must get ourselves examined for the cancer. Loss of appetite. Patient is not feeling like eating. Patient is having fatigue. Patient is having weakness. It can be a sign of malignancy from the organs like gallbladder, pancreas, or any other cancer which may be presenting in your advanced stage. So all these symptoms we should not take lightly. We must get ourselves examined from a nearby clinical physician and take out whatever the doubt inside, it will get cleared. So once we reach a hospital, what should be the approach? Many patients are confused that what to do, what not to do. So remember one thing, the most important thing is that we have to know whether you have cancer or you don't have a cancer. So we will examine you. If there is any abnormality, or if there is any lump, or if there is any ulcer, or if there is any solid swelling, that will be biopsied, either excision biopsy or either FNAC or either true cut biopsy, that will be biopsied. So biopsy is going to tell you the diagnosis whether you have a cancer or not. Now, after the biopsy, you need to know that how much it has spread inside your body. For that, you need imaging. It may be CT scan, it may be MRI, it may be PET scan, depending upon what type of cancer you have and what sort of investigations are needed. We must remember one thing: we should stop ourselves in being over investigating ourselves. So we have seen a lot of patients, they do all the investigations which may not be required. Remember, if any investigation does not add to our staging or does not change to our treatment plan, that investigation is not required. So it's not that for our own satisfaction we want to do something, because these all investigations also have certain side effects. You must understand one CT scan is equivalent to 400 chest x-rays. So we must be very judicious in investigating ourselves. So, and then if we diagnose the treatment early and we do treatment whatever is required early, so that has benefit, that has improved survival. Studies have shown that early stage cancer, if it is picked up, it can be treated and cancer can be cured. So what does that mean? This means that if we take certain dietary and lifestyle modifications within ourselves, we may be able to prevent the progression of cancer within our body. So, cancer is preventable. If we identify cancer, if we are very much intelligent to identify cancer very early in ourselves, we may be able to cure it. We may be able to cure it. So cancer is treatable. And when we cure it, we overcome the threat that it poses to our life. So this means that cancer is defeatable. So my humble submission to all my audience is that please, we must follow a proper diet and lifestyle. If you want to take an opinion of a dietitian or a cancer physician, you must take, because everybody's body is different. One prescription does not apply to another prescription does not apply to another. So rather than searching internet, getting confused and taking one information or the other, which may or may not be necessarily right, it is better to always consult a treating physician who will give you good advice depending upon your habits, depending upon your food which you eat on routine basis. We can make a proper diet charting. Will be able to see what are your requirements, and how you can what are the dietary and lifestyle modifications required for yourself, which you can follow so that your cancer progression can be prevented. Another important thing is that we all must not ignore the signs and symptoms of a cancer. Any symptom which is unusual, which is persisting, which is not getting subsided by any any medication, for example, dysphagia or difficulty in eating, or a feeling of acidity type, can be a sign of food pipe or stomach cancer. So we must not ignore all these symptoms. We must get ourselves checked without fear. So if we follow a proper diet and lifestyle, and if we diagnose cancer early, get ourselves treated early, cancer can be prevented, cancer can be treated, cancer can be defeated. Thank you very much. Hello.